Call on Palmetto Promise, Mr. Oran Smith is here, and Mr. Alan Stalvey, you're on deck.
Okay, thank you, Mr. Chairman. Oran Smith with Palmetto Promise Institute. We're a public policy research organization based here in Columbia since 2013. And with me today, I have the boss, Wendy Damron of Mount Pleasant. We also have with us, visiting with us here in Columbia, trailing us today and watching our every move, Charlotte Cross, who's a student at Clemson, and glad to have her with us as our guest. Well, in 2020, Palmetto Promise Institute wrote a football-themed document called the Palmetto Playbook, and in it was 60 or so ideas for things that would be good for South Carolina in the wake of COVID. And that list grew and grew. We looked all over the country for examples of legislation that would help recover from COVID and help our economy recover from COVID and look at the world maybe in a different way than we had before COVID. And we saw this bill in Oklahoma, which was labeled a healthcare price transparency bill. So we started to write about it. I think we've written about it 6 or 7 times on our blog, and just so glad to see bills being filed. And just to give you a little bit of history, this is really a bipartisan themed effort, because in 2021, H 4030 was filed. Mr. McKnight, Mr. Wooten, Mr. Caskey, Ms. Kimmons, and Ms. Trantham. And then also 2021, 3401 by Mr. Garvin. And then currently over in the Senate, S 185 filed by Mr. Fanning. And of course, this bill, Mr. Sessions, Mr. J.L. Johnson, Mr. Pope, and Mr. Guffey. You know, conversations you have around the Christmas dinner table, sometimes they wander beyond family and talk about things that are going in your lives. So the last Christmas dinner I had, the question became, well, how's your health? And once someone around the table said, well, I'm going to have a procedure, been to the doctor, now I'm going to have a procedure. And someone says, wow, you know, that sounds like something that's potentially expensive. And then the relative around the table said, well, really, I have no idea what it's going to cost. I just know I have to have this. So we began to talk about the idea of what we've been talking about here with the healthcare price transparency. And I think everyone in my little focus group of a handful of folks that were related to me, Chairman Smith, they all thought it was a good idea. But fortunately, we have some public policy polling that shows that nationwide, 87%, that's 89% of Republicans, 89% of Democrats, and 81% of independents believe that healthcare price transparency will be a way to help control cost and increase access for families. So I went to the Greg Delaney School of Legislative Testimony, so I'm not going to talk when I think we may be in good shape here. So thank you, Mr. Chairman.
Thank you so very much for all of your hard work, your faithfulness, and all of your team as well. We appreciate hearing from you.